in her 12-year-old boy who has a 4-day history of fever and generalized weakness. She says her son was involved in a fight at school 4 days ago and sustained minor injuries to the face. This morning, he started to complain of pain in his right eye. Physical examination reveals periorbital erythema and edema of the right eye, along with ophthalmoplegia and proptosis. Which of the following findings will most likely be present on the affected side of this patient as a sequelae of his current condition? The options are anesthesia along the cranial nerve V3 distribution, which is 5, decreased vision with sparing of the optic disc, monoocular diplopia, intact sympathetic innervation to the pupil but not parasympathetic innervation, and absent blink reflex. All right, so this is a 12-year-old boy who has fever, malaise, which is generalized weakness. He sustained minor injuries to the face and he has been having pain in the right eye with periorbital erythema, edema, ophthalmoplegia, which is paralysis of the extraocular muscles, and proptosis, which is kind of bulging out. Which of the following findings will most likely be present on the affected side of this patient as a sequelae of his current condition? So first we have to diagnose what this patient have, then we have to think about what is a complication, and then we have to answer this question because they are asking that this patient will be having will most likely have a finding that is present as a consequence of his current condition. That means his complication of what he is having right now is what is causing one of these answers, right? And that is the absent blink reflex. Orbital cellulitis, right, where you get inoculation of bacteria within the orbit because of a trauma. So it causes this erythema, edema. Sometimes it can also cause vision issues, paralysis of the extraocular muscles and kind of bulging it out. So it's orbital cellulitis. Usually it is caused by trauma. And its complication that we are talking about over here is cavernous sinus thrombosis or thrombophlebitis. Okay, so the cavernous sinus thrombosis or thrombophlebitis, this condition is very life-threatening, okay, because it has very important structures in it, including cranial nerve 3, 4, V1, 6, and internal carotid artery. 5 structures goes through the sinus, okay? And this sinus receives venous drainage from both superior and inferior ophthalmic veins. These veins, they drain your orbits, they drain your nose and sinuses as well, okay? Now, when you have cavernous sinus thrombosis or thrombophlebitis, all of these structures that it contains will be involved, right? And so here we are talking about V1 being involved because over the options over here, what we have is V1 because V1 is part of blink reflex. And when you have that nerve involved, you won't be able to have it. When we go over the other options, you will realize why we ruled everything out. Okay, and efferent for the blink reflex, which is kind of the nerve that is involved, the cranial nerve is 7. Okay, the facial nerve. You can do physical exam to diagnose this patient. You can also do CT and MRI as well, and treatment would just be antibiotics for orbital cellulitis. And if there is a drainage in within, whether it's in cavernous sinus, whether in the orbit, you just have to drain it. Okay. So the other options, which is anesthesia along the V3 distribution, remember that the structures I mentioned, V3 is not part of it. Okay, so it's not going to be involved. There's not going to be any anesthesia along V3. It's going to be totally fine. All right. There's decreased vision with sparing of the optic disc. There is decreased vision, right? As I mentioned, vision will be involved, but it's not going to spare the optic disc. It's going to be involved because patient is already having swelling and bleeding behind the eye, right? Patient is having proptosis. It's going to be with the edema of the optic disc, not sparing. It's not going to spare it. Monoocular diplopia. So monoocular is not the answer. I think this patient will be having the binocular diplopia, what we call it, because monoocular is usually just one eye being involved in the corneal damage. And also like closing the other eye is not going to resolve it because you just have one eye and the cornea being affected. This patient will have binocular diplopia because the patient has ophthalmoplegia. Okay, binocular is basically due to the paralysis of the extraocular muscles, and that's what causes the diplopia in this patient. It's going to be binocular and not monocular. Okay, intact sympathetic innervation to the pupil and not the parasympathetic. So as I mentioned before, the internal carotid artery runs or it passes through the cavernous sinus. And as I mentioned in the previous question, that internal carotid artery has a sympathetic plexus kind of over its wall. So both the things gonna go together. So option D, that is intact sympathetic innervation to the pupil, is going to be incorrect. Because if we are saying that structures within the cavernous sinus is gonna be involved, then the sympathetic plexus over the internal carotid artery will also be involved. Does that make sense? Right? Moreover, we have parasympathetic, right? We have cranial nerve 3 also passing through the cavernous sinus. And so both sympathetic and parasympathetic will be affected.
Thanks for watching. Please give a thumbs up and subscribe for more.